It can seem like a bad dream, can't it? One minute you're in your car driving, the next minute you're in the middle of all this chaos, possibly hurt. Because of someone else's negligence, your life has been changed forever. It's no dream, it's reality. And for you, the reality is that all this may have a lasting effect on the rest of your life. Of course, there are financial repercussions. Dealing with the insurance company, getting your car fixed or replaced, police reports, rental cars. It can be a frustrating, baffling, and aggravating time. And unfortunately, the accident itself is just the beginning. What follows is a period of transition, especially if you've had an injury to your head, neck, jaw, or spine. There are important things you ought to be aware of which will affect not only your immediate recovery, but the consequences of your injury later in life. You have to be aware that the emergency room is equipped to evaluate life-threatening conditions and to provide emergency first aid treatment only. The emergency room staff focuses on broken bones, hemorrhaging, internal injuries, emergency situations. Beyond that, there's not much else they can do. Unfortunately, a lot of the damage done in a rear impact accident, especially this hyperextension hyperflexion syndrome we call whiplash, does not show up in an emergency room exam or x-rays. And it usually isn't until several hours or even days later that the symptoms of a whiplash injury become apparent. So the emergency room physician, finding no immediate life-threatening situation, releases the patient with a prescription for pain, advice to use ice, and consult her own doctor if symptoms persist. You need to know that your hyperextension hyperflexion injury should be treated just as aggressively as a broken bone, perhaps more so, because the potential for long-term consequence is far greater in soft tissue injury than in broken bones. Let's learn why. What do we mean by soft tissue? Simply put, it means everything except bones. Ligaments, nerves, muscles, discs, tissues that don't show on an x-ray. So what happens to this soft tissue in an accident? Even in a slow-speed collision, the forces applied to bones, muscles, and joints of the body are clearly capable of inflicting significant injury. Almost all joints are pulled and twisted. Some are more capable than others of remaining stable. However, the neck and spine are highly vulnerable in rear impact collisions. Because the body of the occupant is first accelerated by his seat, the head remains relatively stationary while the torso moves forward underneath. This results in tremendous forces in the neck. Then, just as the neck is stretched to or beyond its normal limits, the torso has stopped its forward motion, and the head is then accelerated with up to 5 times the g-force that the car was accelerated with. In this case, the head is subjected to 26 Gs. What is the result? Muscles and ligaments can be stretched beyond their breaking strength. Discs can be damaged, nerve roots or the spinal cord can be injured permanently. Won't this soft tissue heal itself? The answer is not as simple as yes or no. You see, while the body is capable of healing itself, it does so somewhat imperfectly. Let's take a look at the way the muscle heals itself. In the very early stages of a muscle injury, such as a strain, the body reacts in a fairly stereotypical way. This is known as inflammation. This consists of 4 things: pain, swelling, heat, and redness. This same generic type of reaction occurs in infections, burns, or other forms of trauma. One of the byproducts of this inflammation is scar tissue. Unfortunately, if this inflammation is left untreated, the result will be excessive scar formation. This limits the muscle from contracting and relaxing properly. As new muscle fibers are forming, they of course need to be reconnected with new growing nerves, because muscle needs a nerve supply just like electric motors need electricity. But this ingrowth of new nerve is interfered with by excessive collagen or scar formation. The nerve can't get through to the muscle to reinnervate it. The body's natural reaction is to continue to try to reinnervate this area by sending in still more nerves, until the result is an area containing more nerves than normal surrounding tissue. And obviously, an area with more nerves is more sensitive to pain. Now, everyday activities will pull at this scar, which is less pliable than the surrounding muscle. And the result is that this area continues to be more susceptible to re-injury. Fortunately, your chiropractic physician knows how to control inflammation so that your body will heal with the least amount of scar and the most amount of normal function. Regardless of how imperfectly muscle heals, it does heal owing to its rich blood supply. Ligaments, on the other hand, are composed almost entirely of collagen and elastic fiber, and as such are nearly devoid of blood supply, except in a very superficial way. Ligaments, because of their poor blood supply, heal slowly and incompletely, and consequently need all the help they can get. But in order to understand how your chiropractic physician deals clinically with this condition, we should first review the position of the ligaments in the neck and discuss their function. The ligaments attach to the margins of bone. Unlike muscles, whose job it is to move the head and neck, ligaments are present only to protect against excessive or unwanted motion. Without the ligaments to check this motion between individual vertebrae, even the slightest force could pinch the nerve roots as they exit from between these bony structures. This causes such symptoms as weakness, chronic pain, numbness, or tingling. As we bend our neck forward, the strong ligaments of the back of the neck protect against unwanted movement of the intervertebral segment and protect the nerve root from being pinched. In a similar way, when we bend our neck backward, the strong ligaments of the front part of the spine protect against unwanted movement. When these protective mechanisms are damaged, you can easily see how the nerve roots can become irritated or compressed. In more severe cases, the spinal cord itself is at risk of injury. As you can see, the spinal cord is encased in the bony confines of the spine. Again, excessive motion can irritate or injure the cord. Your chiropractic physician is an expert at determining how much instability is present and exactly how best to treat it. In fact, whiplash injuries are usually referred to chiropractors for treatment. The fundamental reason for chiropractic treatment in this type of injury is that when a neck is injured, the muscles go into spasm in an attempt to splint or immobilize the area. As a result, the neck feels very stiff. The unwanted side effect of this spasm is that joints adjacent to the injured segments eventually lock up. Movements of the neck then occur primarily at the injured and least protected segments, and this delays or prevents healing of these tissues. The chiropractor is the only specialist licensed to practice in the United States who's specially trained to diagnose and correct these locked segments. This then reduces the stress on the injured area by allowing a wide distribution of movement throughout the neck. The next thing that we're concerned with is the discs themselves. These cartilaginous structures act as the spine's shock absorbers, and also they provide space between the vertebrae to allow for normal motion and to prevent pinching of the nerves. Now, discs, being entirely cartilage, have no blood supply at all. Yet the cells of the disc are alive. They get their nutrients from the fluids that are washed through the end plates of the vertebrae that they're sandwiched between. As we move, these fluids are pressed into and out of the discs, and these fluids come from the rich blood supply of the bone marrow of these vertebrae. Their health, therefore, is highly dependent upon motion. This is the main reason why the chiropractic physician adjusts the neck, to provide normal intersegmental motion. This is an X-ray of a normal cervical spine. These are the disc spaces. Notice that they're all about equal in size. This is an X-ray 5 years after a whiplash injury. As you can see, significant degeneration has occurred at the disc and adjacent vertebrae. If we can reduce the amount of disc degeneration, we can also reduce or prevent the development of osteoarthritis, which is the type of arthritis that eventually forms in the neck as a result of disc degeneration. In one study, it was determined that in patients who have had whiplash, 39 to 60% of them developed osteoarthritis in the ensuing years, while only 6% of patients who had not been whiplashed developed the disease. In another very famous study, patients were interviewed more than 2 years following the settlement of their cases. Without chiropractic care, fully 45% continued to complain of ongoing pain and disability related to their accident, and this was probably a conservative figure. The goal you and your chiropractor have is to prevent or reduce this long-term consequence to whiplash injury. The chiropractor's approach is three-pronged: reducing unnecessary scar formation by controlling the inflammatory state, maintaining normal intersegmental motion and thereby assisting in the healing process of ligaments and discs, and rehabilitating injured tissues through various forms of therapy and exercise. It is the patient's responsibility to begin treatment as soon as possible after the injury and to continue treatment until the chiropractor determines that the injury is completely healed. For the quickest resolution of your whiplash injury, make sure you follow through with all of your chiropractor's recommendations. Right now, you may not be thinking about what effect this injury will have on you 20, 30, 40 years from now. But this is the best time to think about that. Remember, the more closely you work with your chiropractic physician on an effective treatment plan for your injury, the more likely it is that your injury will heal completely and thoroughly and not be the cause of even more serious health problems later in life.